So go. All right, I'm Joanna Anderson. I'm a nurse on the orthopedic unit at Saddleback, and I'm going to go over with you the OrthoPat, which is our total knee and total joint patients, knees and hips. Some of our physicians use this reinfuser to give back autologous blood to the patient after surgery. So our patients come up from the OR, total hips and total knees, and they come with this OrthoPat system with them. This it would be the drain that would go to the patient. So that comes off the side. Mm-hmm. So this goes to the patient's total joint, mm-hmm. and it's draining. Mm-hmm. The drainage collects in this chamber, and once it reaches a sufficient level, it is pulled into this a spinner in the middle. Up here we would have about a bag of saline, so it pulls saline down, it rinses and spins in the middle, and it dumps the waste into this bag on the side, okay. And it gives us nice red blood cells into this bag in the front. Mm-hmm. We collect for 4 hours is our time limit, mm-hmm. into this collection bag, and then we reinfuse the patient, and we would put on a new bag at that time.
Mm-hmm. And when they come back, in your experience, how often does this happen? A normal drainage, 1 or 2 bags?
2 or 3 bags usually.
2 or 3 bags? Mm-hmm.
And usually sometimes during the first night, the drainage lessens to where there's less than 104 hours, and the night nurse will change it into a hemovac. So by the next morning, you don't see this large machine at the bedside when the therapists come. They'll just have their drain, and it'll be converted to a hemovac.
Mm-hmm. Okay.
So there are several things that we have to make sure of when we get the patient back, is that it's plugged in, that we have 4 lights showing. It's post-op, run, suction, and process. And that way the machine does its little processing and spinning. And when we go to reinfuse, we just press stop, and we change out the bag. Mm-hmm. We reinfuse the blood just like a unit of blood, mm-hmm. with saline and blood tubing.
And how much blood is usually in there if you
it
filled
varies,
it up?
It varies quite a bit. Mm-hmm. There are markings so you can see how much you do have. Sometimes there's as little as 25. Sometimes there'd be a couple hundred in there. Mm-hmm. Sometimes the total knees put out quite a bit, and the bilateral total knees put out really a lot. So it's really savings for them to mm-hmm. get their own blood back.
Correct.
So generally it's used for the first probably 12 hours post-op, and then it's changed to a hemovac.
All right.
And documentation is done in Epic. We have to add a category for lines and drains OrthoPat, and we put how much comes out, and then our reinfusion is under blood and blood products, and product type is OrthoPat reinfusion. Mm-hmm. We put the time and amount that we give back in there.
So for those hospitals that are on the computer paperless system already, they would have to put in their own column for the OrthoPat. It's not a standard column.
Mm-hmm. Right.
Correct. All righty, very good. And if you're doing paper charting, you would just chart it
under your eyes and nose.
Right, correct.
The thing with the OrthoPat is the output doesn't equal the intake. It's not an even because it's being rinsed and spun down. So your intake that you're giving back is a lot less than your output.
Correct. Now, is there a section in here for where it's collecting? Because the gravity would be seemed like it would be going uphill.
The machine does that processing. We don't actually hook it to any kind of suction.
All right.
In surgery, they might.
All right.
That's why we have this little suction head here.
Uh-huh.
We don't put it to any suction. The machine pulls it. As
All
it's
right.
processing, the machine pulls it.
Because it must be plugged in.
Right. It has to be plugged in. As it
All
reaches
right.
a certain level, then it'll bring that blood up and rinse and spin it and
okay.
go into this little bag.
Great. Thank you, Joanna. Is there anything else?
You're welcome.
All right.
That's it.
All right.